My name is Dr. Anil Sachdev, and I am here to talk to you some more about the coronavirus. The name of the virus is SARS-CoV-2. The name of the family of viruses is the coronavirus. It is not just one, it is a family of viruses. The name of the condition that develops as a result of incubation of this virus is COVID-19. If you are exposed to the virus, it can potentially incubate typically in your upper respiratory tract, nasal cavity, larynx, pharynx, and the upper portions of the trachea can typically incubate for up to 14 days. This means even though you are symptom-free, you may still be carrying the infection. Then, if the symptoms start to develop, the first symptom, 87.9% of patients complained of fever, 67.7% of patients complained of a dry cough, and 38.1% of patients complained of fatigue on day one. Just because you have one or not the other doesn't mean you're symptom-free. It means you could be carrying the virus if you have any of those symptoms. Day two develops into difficulty breathing. The difficulty breathing normally resolves after a few days after the exposure to the virus. But if the difficulty breathing continues for up to 7 days, you must call an ambulance, you must get down to your nearby hospital. When that happens, the infection can spread from the upper respiratory tract down to the lower respiratory tract. If this happens, your lungs can be packed full of inflammation and fluid. If the fluid builds up in your lungs, it is going to inhibit the natural gas exchange of carbon dioxide and oxygen in your lungs to the blood. That is what we call ARDS, acute respiratory distress syndrome. That is where you need to be in hospital and you need to have people helping take care of you. If the difficulty breathing continues up to 10 days after the symptoms start, then you could be admitted to the intensive therapy unit. What will usually happen is they will help with your breathing and they will help to keep you alive. In most cases, the fever and the conditions end after 12 days to 2 weeks. Now let's talk about mortality. Those who die are typically either elderly or have multiple comorbidities. The most frequent comorbidities contributing towards death through COVID-19 are cardiovascular disease, diabetes, chronic respiratory diseases, hypertension, and cancers. Stay healthy, monitor your diet, exercise throughout your entire life, and you are less likely to be subject to death via COVID-19. Here is how it is transmitted. The virus can live in the air for up to 3 hours. If patient A is carrying the virus and patient A sneezes, the droplets of phlegm and mucus spray out, over 1,000 droplets per sneeze. Those droplets live and free flow in the air. The virus can exist in those droplets for up to 3 hours. If patient A touches cardboard, the virus can live on that cardboard for up to 24 hours. If patient A touches copper, virus can live on that copper for up to 4 hours. If patient A touches stainless steel or touches various plastics, the virus can live on that surface for 2 or 3 days. Stay home, wash your hands, clean your surfaces thoroughly. I know it's frustrating, but this is how we as a society are going to beat this infection. Stay home, stay isolated, remain safe. Remember this, even though you are symptom-free, you could still be carrying the virus. If you go home to see your mother, your father, your grandmother, or your grandfather, they may have comorbidities. This virus can live on your cotton fabric, on your clothes. It can live in your hands. It can live in the air around you. And it could infect one of your relatives and it could kill them. So please stay safe, wash your hands, wash your clothes, clean your surfaces, and isolate. Thank you very much.